I think we all believe that for any drug, Belzu or any drug, any setting, that we all care that we're making patients better and not worse, right? So if we're only shrinking tumors a little bit or controlling their disease a little bit longer, but the drugs are super toxic, none of us would really want to do that, and patients don't want to receive it. So the concept of quality of life is that let's make sure, that the treatment's not worse than the disease, right? The tricky part, and I think Tom highlighted it this morning, is that our tools to measure that are super imprecise. They're old questionnaires. They don't measure the right thing. They were developed in a different era. The way patients fill them out is imperfect. The way we capture data is imperfect. So there's a lot of imperfection of how we do that. What Tom presented was basically showing, that belzutifan's a really well-tolerated drug that does not lead to decrements, substantial decrements in quality of life. And everolimus is a little more toxic and a little more impact on quality of life. So to me, this was a clean look at quality of life because it was one drug versus one drug as opposed to combinations. And it's believable, right? I've given plenty of both of these drugs, and belzutifan is definitely a better tolerated drug. And with, I believe, minimal impact on quality of life, having given it to probably dozens of patients now. But the tools to measure that are still imprecise. And we as a field, not just kidney cancer, but all of solid tumor oncology, need to do a better job of developing those tools so that we can speak with more confidence to patients that, yes, we're actually making your life better and not worse. And hopefully longer. We don't know that with belzutifan yet, but hopefully, every medical decision I make, I ask myself, am I making this patient live better or longer, or both? Right? The better part is where quality of life comes in, but our ability to measure that is limited. I think just that, again, it's a really well-tolerated drug, that you're not harming patients' quality of life by doing this. And we know it has progression-free survival and response rate benefits. We'll see about overall survival with further analyses. So it's, it's a complement to the strong clinical data that was already there. And frankly, the strong toxicity data. So it's a different way to measure toxicity, might be one way to think about it, as opposed to grade 3 this and grade 2 that, and these percentages, which, are these big busy tables that sometimes we don't understand. It's a complement to that. So I think, belzutifan was FDA approved. It was a month or so ago. Probably getting a lot of use. I'm using a lot in my clinic, and I think these data complement that.